Is everybody eligible for a kidney transplant?
Sure, there's a fair number of people who aren't eligible, and mostly it just has to do with expectations and outcome and whether they can tolerate the surgery and whether they can tolerate the anti-rejection drugs, and the anti-rejection drugs may have bad consequences for them. So if somebody has, let's say, cancer, and they're on treatment for their cancer, then they would not be in a good enough shape to be able to withstand the anti-rejection drugs. If somebody has a very bad heart, then the surgery itself may put them at big risk, because we have to give a lot of intravenous fluid during the surgery to sort of get the kidney kick-started, and if your heart isn't strong enough to be able to handle that, then the surgery becomes quite risky. So when is somebody not able to get a transplant? Usually it's because they have a bad disease like cancer or another really significant medical disease, but it usually comes down to the heart and the blood vessels.
Right.
And so some people have such diseased blood vessels from years on dialysis with a lot of calcium in them that technically it's impossible for us to actually get to the blood vessel, be able to sew the new kidney's blood vessel onto that blood vessel. And so sometimes we have to say, unfortunately we can't do it because of your blood vessels. So those are the big reasons.
Do we have a sense of like a percentage of how many kidney patients that have to be on dialysis or cannot go the route of transplantation?
Well, it also depends on age, right? So, clearly we've expanded our age limits, and we've transplanted people in their 80s, but at some point.
And that's an interesting point, because I think a lot of people wouldn't realize that in your 80s, it's still possible to have a transplant.
Not for everybody,
yeah.
Sure. I think, but you have, so our guiding principle is if we think you have 5 years of life ahead of you, with a transplant, with a reasonable expectation of success for 5 years, then we think it's the right thing to do. And so there's a percentage of people on dialysis who are just, past that point.
Right.
And we know there's a lot of elderly people on dialysis, and so it's those people, mostly those people on dialysis, the very elderly or the very frail. So putting it at a number, it's about 30%.
30%,
probably, or that,
right.
Who are medically not strong enough.
We're going to talk about why would someone actually consider donating a kidney.